Wake up every day, know that I am blessed, yeah. Counting on my cake, getting all them checks, yeah. Pull up in the rain, I'm just trying to flex, yeah. Why you wanna hate? You do it the best. I'm a high roller, what? Yeah, you know I'm a high roller, yeah. Yeah, you know I'm a high roller, yeah. Yeah, you know I'm a high roller, huh? Yeah, drop it like I stole it. Double parking, bitch, you better not told it. Yeah, yeah. Please show me on.
Cut that damn music off. It's time to study, bitch. And today we talking about burns, effects of burns on body systems. Burn injuries cannot, I'm not reading that anyway, circulatory system. Burn injuries can cause extreme fluid loss and increase stress on the heart. Burns increase capillary permeability, or the ability of fluid to leak from the vessels, which decreases the fluid volume inside the vessels. As fluid leaks from the damaged tissue cells to areas between the cells, it creates edema, or swelling, which can further compromise tissue perfusion to local capillary beds as well as perfusion to distal tissues. A condition that can occur with moderate to major burns that cover sufficient body surface area, or BSA, is called burn shock. Burn shock, I was supposed to say that in a regular tone, my bad. Burn shock, which develops only after the first few hours, results from extensive vascular bed damage that allows both fluid and protein molecules in the plasma to leak into surrounding tissues. From where? From the capillaries to leak into the surrounding tissues. I just want to see if y'all was keeping up. Shit, cross the street with me, goddammit. The loss of plasma proteins causes the normal fluid balance of the rest of the vascular system to become disturbed, and as a result, blood plasma starts to seep from all capillary beds, even those not involved in the burn itself. The end result is a large fluid shift out of the vessels and into the spaces surrounding The end result is a large fluid shift out of the vessels and into the spaces surrounding the cells to a point where the total vascular volume is insufficient to meet the body's needs. This also explains the extensive swelling seen in the burn patient. In the first 24 hours after a burn injury, as a result of the fluid loss from the vessels into the tissues, the edema may cause the body to swell to double its size. Damn, that's crazy, right? As a result of fluid loss from the vessels into the tissues, the edema may cause the body to swell to double its size, its normal size. All right? And that's with the burn injury. The fluid loss just described can lead to shock. Why? Because it's volume loss. You know what it is. Major burns will require large amounts of fluid replacement during the patient's hospitalization. For example, an average adult patient with a full or partial thickness burn area of 50% BSA, body surface area, may need as much as 15 liters of fluid in the first 24 hours after a burn injury. However, fluid losses are usually not significant in the early hours of a burn. An EMT who finds a newly burned patient in a state of hypoperfusion should first consider direct blood loss from an associated external or internal hemorrhage. Why? Of course, because you're not going to take care of everything right there because they still losing volume, so you need to hurry the freak up. Respiratory system. Burns may affect the respiratory system in a variety of ways. Swelling of the face or throat may cause airway closure. Inhalation of superheated air may cause the lining of the larynx to swell, laryngeal edema, and may cause fluid to accumulate in the lungs. Smoke and toxic gas inhalation may cause respiratory arrest or compromise or poisoning from noxious fumes. If the patient is in an enclosed space, he would have a higher probability of having an inhalation injury. If the chest is circumferentially burned, I used to be able to say that word back in a couple of days ago. Circumferentially. Oh Lord. If the chest is If the chest is circumferentially burned, S-char, tough, leathery, burned skin, which is S-char, may restrict chest expansion. Renal system, kidneys. The decrease in blood flow from fluid loss caused by a burn will, of course, cause decreased blood flow to the kidneys and a consequent decrease in urinary output. Also, the burn injury will cause many wastes to form in the blood because of cell destruction, such as myoglobin from muscle destruction. This is particularly, that's another word that fucked me up all the time. This is particularly true with electrical burns. Since the kidneys are responsible for filtering the contaminated blood, a blockage in the kidneys may also result. In the end, this may cause all or parts of the kidneys to stop functioning. Nervous and musculoskeletal system. Burn injuries can destroy nerve endings in the burn area and cause loss of function to extremities or other body parts. An extremity burn may cause loss of function, long-term muscle wasting, and joint dysfunction because of scarring. Patients who face loss of function, extreme pain, and scarring will also be prone to fear and anxiety. These patients may need both medical and psychological help to aid the healing process. Gastrointestinal system. Although it is low priority for the EMT, the gastrointestinal system plays an important role in the long-term care and survival of severely burned patients. As blood flow is decreased, blood is rerouted from this system to the rest of the body. Nausea or vomiting are common in burns of greater than 10% body surface area and can further upset normal chemical balances. And long-term stress may cause ulcers. In order to promote healing and survival of burn patients, the gastrointestinal system must be kept functioning properly to ensure adequate nutritional support for healing. Assessments and care of burns. Classifying burns by depth. Burns are classified according to depth of the injury. Burn injuries involving the skin are classified as superficial, first degree, partial thickness, second degree, or full thickness, third degree. Burns. In most cases, you can quickly classify the burn as you form your general impression and establish a more detailed evaluation during the secondary assessment. A fourth degree burn also exists and is commonly associated with electrical injuries. Superficial burns, which are to the first layer of the skin, formerly referred to as a first degree burn. A superficial burn involves only the epidermis. Usually a superficial burn is caused by a flash or a sudden occurrence of heat or flame lasting only a few seconds. Hot liquid or the sun. The skin will appear pink to red and will be dry. In some cases, there may be slight swelling, but there will be no blisters. The skin will be soft and tender to the touch. Although superficial in nature, affecting only the epidermis, these types of injuries may be very painful because the pain receptors in the underlying dermis, second layer of the skin are still intact. Superficial burns generally will take several days to heal, but will not require much emergency medical care if only a small area is injured. The injury may cause the epidermis to peel, but not cause any scarring. Examples of superficial burns include sunburn or a minor scald injury. Partial thickness burns, formerly known as a second degree burn. A partial thickness burn involves not only the epidermis but also portions of the dermis. Partial thickness burns occur from contact with fire, flame or flash, hot liquids or objects, chemical substances, or the sun. In addition, damage to the small blood vessels causes plasma and tissue fluid to collect between the layers of skin and form blisters. Since pain receptors are still intact, the patient will complain of pain from the burn. Partial thickness burns are further classified as superficial partial thickness and deep partial thickness burns. The signs and symptoms are as follows. Let's read that again, one more again. Partial thickness burns are further broken down or further classified into two separate classifications, that is. You have superficial partial thickness burns, which means, of course, it's not that deep. And you have deep partial thickness burns, which means it's pretty deep. The signs and symptoms of those two further classifications are as follows. Superficial partial thickness burns. Thin-walled blisters result from superficial dermal layer damage. Skin is pink and moist. The moisture is caused by, let's start that over. Superficial partial thickness burn, signs and symptoms of that. Thin-walled blisters result from superficial dermal layer damage. And then the second one is skin is pink and moist. The moisture is caused by small leaks in the capillary beds caused by the burn. Third and lastly, the last sign and symptom of superficial partial thickness burns is skin is soft and tender to touch. Skin resiliency and hydration are normally preserved, but the skin will be more tender to the touch. All right, deep partial thickness burns. Signs and symptoms of deep partial thickness burns are as follows. Thick-walled blisters often rupture. The more severe nature of the blisters occurs because the dermis is injured at a greater depth, and they tend to rupture with any body motion or accidental friction because of their large size. Skin is red and blanched white. Deeper levels of the epidermis and dermis are injured. The patient can still feel pressure at the site. Pain receptors in the dermis may now be damaged and less responsive in some situations, but pressure receptors are found deeper in the dermis and may still be intact. There is more capillary refill to the burn site. Increased edema starts to compromise capillary beds in the vicinity of the burn. All right, and that was the last one there. Partial thickness burns cause intense pain resulting from damage to nerve endings. Examples of partial thickness burns include thermal flame burns or severe scaldings. It burns! Full thickness burns, last one. Formerly, do you know what a full thickness burn was formerly known as? AKA BKA? Third degree burn. You're right, buddy. Or young lady, formerly known as a third-degree burn. A full-thickness burn involves all the layers of the skin. This type of burn results from contact with extreme heat sources, such as hot liquids or solids, flame, chemicals, or electricity. The skin will become dry, hard, tough, and leathery, and may appear white and waxy to dark brown or black and charred. The tough and leathery, dead soft tissue formed in the full-thickness burn injury is called eschar. Most full-thickness burns are not very painful because nerve endings have been destroyed, so you can't feel a thing. However, big ass comma. In most such injuries, there will be surrounding areas of partial thickness and or superficial burns that may cause intense pain. Got that? So, of course, some burn injuries may be deeper than others, but, above those or surrounding those third-degree burns may be second and first-degree burns or partial and superficial burns, and you still have nerve endings, so it's going to hurt. Full-thickness burns are often evident in patients who have been trapped in a confined space with flames or who have been exposed to a high heat source or chemical contact. Some full-thickness burns may also be categorized as fourth-degree burns. A fourth-degree burn is a very deep burn that extends completely through the epidermis and dermis and deep into the tendons, ligaments, muscle, bone, blood vessels, and nerves. Damn! These burns are typically associated with electrical injuries and require extensive skin grafting to allow the site to heal. Yeah, if that shit burned through all of that, man, that's a real deal. They said fourth degree. Determining the severity of burn injuries. The EMT must classify the severity of the burn injury in order to provide the optimal emergency medical care, make the best patient transport decision, and give an accurate report to the receiving facility. The estimate of burn injury severity may be crucial in deciding to which facility the patient will be transported, to a specialized burn center or to a regular hospital, for instance. In general, burns are classified as critical, moderate, or minor. Burns are classified, in general, when we're talking about classification of care, burns are classified as critical, moderate, or minor, all right? In addition to the depth of the injury, superficial, partial thickness, or full thickness, you will consider other factors in determining the severity of a burn injury. For instance, you will often want to consider the source or agent of the burn, all right? A small burn caused by an electrical source may give more cause for concern than a small thermal heat burn because of the electrical burn's potential for internal injury. Likewise, a chemical burn will vary in severity depending on the type and strength of the chemical. Inhalation injuries or burns involving the airway are always considered critical. They dropped a bomb on you. Inhalation injuries or burns involving the airway are always considered critical. All right. Why? Why do you ask? You know what it is. ABCs. That shit is interrupting your ABCs. That's why. That is very critical. If you can't breathe, lack of perfusion, bada bing, bada boom, shock, you could die. All right. Trickle down effect. The most important factors to consider in determining burn severity are, this is key shit. Let's see. The most important factors to consider in determining burn severity are 1. Depth of burn. 2. Location of the burn. 3. Patient's age. 4. Pre-existing medical conditions. And 5. Percentage of body surface area involved. All right. Burn injury location. Just as the depth of the burn injury and its body surface area are important, so too is the location of the burn. Injuries to certain body areas are more critical than those to other areas. Burns of the face are considered critical because of the potential for respiratory compromise and long-term cosmetic concerns, as are injuries to the eyes or ears. Hands and feet are also given special consideration because of the potential for loss of function. Burn injuries to the genital or groin region are of concern because of the potential for loss of genitourinary function and increased chances for infection. Finally, burns that occur to regions of the body where there is major joint function, for example, hips and shoulders, may be considered critical because of No, I don't smoke. I just inhaled a whole lot of oxidation or whatever. Finally, burns that occur to regions of the body where there is major joint function, for example, hips and shoulders, may be considered critical because of loss of joint function. Should the injury not receive appropriate burn care early in the course of recovery. Circumferential burns, which encircle a body area such as an arm, a leg, or the chest. A circumferential burns is bold printed. All right, so that is some key shit to remember. Circumferential burns, of course. And they're about to tell us why, y'all. Circumferential burns, which encircle a body area such as an arm, a leg, or the chest, and especially ones that encircle joint areas, are critical because of the circulatory compromise and nerve damage that result from constriction or from swelling tissues. Burns that encircle the chest may impede respiratory function by limiting expansion of the chest. Okay. That's what it is, pimp. Age and pre-existing medical conditions. Age of the patient is also a major factor in determining the severity of the burn. Children under age 5 and adults over age 55 have less tolerance for burn injuries. Children, in addition to BSA percentage differences, body surface area percentage differences, face other challenges of growth process impairment. Because of their relatively larger skin surface in relation to body mass, they have the potential for greater fluid loss and burn injuries than adults. Okay, what does it say? What does it say again? Let's go back. It says, children, in addition to body surface area percentage differences, face other challenges of growth process impairment. Because of their relatively larger skin surface in relation to body mass, they have the potential for greater fluid loss and burn injuries than adults. Older adults have prolonged healing processes and may have underlying medical conditions that affect their response to burn injuries. Any pre-existing illness or injury may increase the severity of a burn injury. A patient with an existing respiratory illness or condition may be adversely affected if there is further respiratory compromise from a burn injury. Right on. A patient with an existing cardiovascular problem may have increased complications from a burn injury and resulting fluid loss. Diabetes will compromise the patient's ability to heal from the burns. What may seem like a minor burn in an otherwise healthy adult may be more severe. That's what they're basically saying, all right? In those patients with pre-existing medical conditions, right on. If the patient has experienced other injuries along with the burn injury, the life threat or potential for shock may be increased as well. Special considerations for infants and children. As mentioned earlier, or as they already told your ass, infants and children have a larger body surface in relation to mass than adults. For this reason, burn injuries can have increased effects on infants and children. Fluid and heat loss are also greater to infants and children than in adults. There is a higher risk for shock, airway difficulties, and hypothermia with burn injuries to infants. All right. Further differences in burn injury severity classification for children less than 5 years old are outlined in Table 29-1. In addition to assessment and emergency medical care considerations, you must consider the possibility of child abuse when a child has a burn injury. Show now. Body surface area percentage. The rule of nines. The rule of nines is a standardized way to quickly determine the amount of skin surface or the body surface area percentage of a burn. The rule of nines is only applied to partial thickness or full thickness burns. You heard that? The rule of nines is only applied to partial thickness or first degree or full thickness. No, look at me. Damn. The rule of nines is only applied to partial thickness, second degree, or full thickness burns, third degree, all right? Partial thickness, full thickness burns. That's the only time the rule of nines apply. Why? Because superficial burns are not that, severe. Anyway, the rule of nines is not applied to superficial burns. I just said that. You didn't even have to say it, book. Damn. In an adult, the head and neck together, each upper extremity, the chest, the abdomen, the upper back, the lower back, the anterior of each lower extremity, and the posterior of each lower extremity, each represents a BSA of 9%. The genital region represents 1% BSA. This rule will guide you in determining the burn severity, categorizing the patient for triage, and alerting the receiving facility as to the severity of the patient. Okay. In infants and children, there are different BSA percentages assigned to body regions because of their different proportional dimensions. The infant's or young child's head is much larger in relationship to the rest of the body than in adults. Therefore, for infants 1 year of age or less, infants 1 and under, they eat free at the buffet, but also the head and neck are counted as 18%. And that's greater than in an adult, because they got a big ass head. The child, that is. The chest and abdomen as 18%, that's the same as an adult. The entire back as 18%, that's the same as an adult. Each upper extremity is 9%, same as an adult as well. And each lower extremity is 14%, which is less than an adult because our lower extremities are what? I ain't gonna tell you. Figure it the fuck out. The rule of nines is altered to allow the head to account for more of the total body surface area. The larger percentage of body surface area for the head was shifted from the legs because of the disproportionate size of the head in infants and young children and their proportionately smaller legs. For children over the age of 1 year, for each year beyond 1, add 0.5% to each leg and subtract 1% for the head. Oh, okay, wait a minute. For children over the age of 1 year, right? Some of them still get to eat free at the buffet, some of them. For each year beyond 1, you're going to add 0.5% to each leg for each year, all right? And subtract 1% for the head for each year over 1, all right? This formula will be used until the adult rule of nines values are reached. For example, I'll read this example. For a 3-year-old child, you would add 1%, 0.5% times 2 years beyond 1 to each leg and subtract 2% from the head. Thus, the legs in the 3-year-old would equal a total of 15% and the head would equal 16%. The head of the infant or child accounts for more of the total BSA than it does in the adult. This is because the head is proportionally larger in younger patients. That you said that. Anyway, an alternative way to determine the BSA estimate is to compare it to the patient's palm of the hand surface area, which equals approximately 1% of body surface area. Oh, okay. This is known as the rule of ones, also called the rule of palms. For example, if the burn area is equal to 7 palm surface areas, then the burn would be estimated at 7% body surface area. You can use this method to estimate a burn area on the patient of any age. You may find it helpful to use the rule of nines in larger burn injuries and use the palm method for smaller burns. You can begin to estimate BSA during the primary assessment. Do not spend time trying to determine the exact percentage of BSA injured. The BSA percentage is an estimate only. The BSA percentage is an estimate only, and slight differences in percentage will not affect pre-hospital medical care. That don't mean just go out there and wing that shit. That means just, don't focus on, oh, no, I didn't carry my one. Fuck that. Anyway, types of burns. There are 5 major types of burns, all right? There are 5 of them, types of burns, major types, that is. Thermal burns are associated with heat applied to the body. There are many causes of thermal burns, including flame, hot water, and steam. In general, the severity of the burn is related to the time the patient is exposed to the heat source and the temperature of the heat applied to the body, and the potential for inhalation injury as described next. It's nap time. Somebody give me some juice and some crackers. Hot water causes thermal burns called scalds. Scalds in children may be a form of child abuse. Maybe. Inhalation burns. Inhalation burns are associated with high temperature air. Inhalation burns are associated with high temperature air or steam that is inhaled and causes damage to the mucosa of the upper airway. This will result in edema that may restrict airflow and lead to an airway obstruction. Another complication is the inhalation of toxic gases such as carbon monoxide and cyanide gas. If the patient is in an enclosed area, he is more likely to suffer an upper airway burn and toxic inhalation. Chemical burns are produced by acids, alkalis, and other heat-generating chemicals. The type of chemical, its concentration, and the duration of exposure to the chemical will determine the severity of the burn. Chemical burns are discussed in more detail later in the chapter. Electrical burns result from resistance to electrical current flow in the body. The burns are primarily internal. The electricity may interfere with the conduction system of the heart and result in cardiac arrest. Electrical burns are covered in more detail in the chapter. Radiation burns occur from the absorption of radiation into the body. Let's talk about the causes of burns. Burns may be caused by a variety of mechanisms. Flame burn. The patient comes into contact with an open flame. The clothing may ignite, causing further burn injury. Natural clothing fibers typically will burn, whereas synthetic fibers will usually melt. Take that fake ass shit off, you embarrassing us. Which causes a contact burn in addition to the flame burn. Yep, that shit's sticking to your skin now. Take that plastic plug off, that shit's sticking to your arm. Contact burn. A burn occurs from contact with a hot object. The burn is normally localized to the area of contact. An example would be touching a hot exhaust pipe on a car. Scald. Anyway. Contact with a hot liquid causes a scald burn. The more vicious... The more vicious the liquid, the more severe. I don't think that's vicious. Viscous? I don't know. Anyway, viscous, vicious, fuck it. The more whatever the liquid, the more severe the burn. Because of a longer contact time, intentional scalds, often seen in child abuse, typically involve the entire extremity from being immersed and held in the hot water. Accidental scalds will show patches of burn separated by unburned areas caused by splashing. Okay. Intentional scalds typically involve the entire extremity from being immersed and held in the hot water. Accidental scalds will show patches of burns separated by unburned areas caused by splashing. Even if you dip your hand in the water, you're going to take that shit out of there so fast. Anyway, steam burn. Hot steam causes severe burns, often more severe than flame burns because of the high heat capacity of steam. Typically, these types of burns are found in industrial accidents or in those who inappropriately open a car radiator while it is hot, you dumbass. Steam can cause thermal burns to the distal airways and the lungs. Gas burn. Hot gases may cause upper airway burns. However, it is not likely that the hot gas will cause distal airway burns. Distal airway injury may occur, however, from the byproducts of combustion rather than from the hot gas. I ain't reading that shit again. That whole fucking paragraph is confused. Electrical burn. Because bones, muscles, and other tissues offer resistance to the electrical energy passing through them, the byproduct is heat, which results in internal burns. With an electrical burn, the clothing may ignite, resulting in a flame burn. Flash burn. This is a type of flame burn, but is the result of a flammable gas or liquid that ignites quickly. Areas of the body covered by clothing normally are not burned. Inhalation is what the hell I just did. Inhalation injury may occur if the flash occurs in a closed space. There is a lesser incidence of inhalation injuries when the event occurs outside. A typical flash burn would occur from throwing gasoline on smoldering charcoal to reignite it. All right, and that is about it. We were talking about burns. That gives you the gist of the burn, all right? Now, I'm about to read over the signs and symptoms of the different types of burns again, the different types of depth of the burns again, all right? So we can get that ingrained in our brain. Signs and symptoms. In addition to estimating body surface area and noting location of the burn injuries, watch for the following signs and symptoms of burn depth and possible inhalation injuries, all right? Superficial burns, pink or red, dry skin, all right? With those, with the superficial burn, you could see pink or red or dry skin, all right? And you might see slight swelling, pain, and tenderness to touch. With the partial thickness or second-degree burns, you might see white to cherry red skin, moist and mottled skin, or blistering and intense pain, all right? With the full thickness burns or third-degree burns, the signs and symptoms are dry, hard, tough, and leathery skin that may appear white and waxy to dark brown or black and charred, which is eschar. Inability to feel pain because of damaged nerve endings, and pain on peripheral edges of burns, all right? Pain on peripheral edges. Why? Because it could be, those edges could be only be burned to partial thickness or superficial burns. So you still have nerve endings there. All right. Inhalation injuries. Signs and symptoms of those include singed nasal hairs, facial burns, burned necks, burned specks of carbon in the sputum, a sooty or smoky smell on the breath, respiratory distress accompanied by restriction of chest wall movement, restlessness, chest tightness, stridor, wheezing, difficulty in swallowing, hoarseness, coughing, and cyanosis. The presence of actual burns of the oral mucosa is the last sign and symptom of inhalation injuries. The presence of actual burns on the oral mucosa. And that is that about sums it up for burn injuries right now. You too can learn like me. Well, as it turns out, I left some shit off. So let me finish this up quickly. When it comes to emergency medical care for the burn patient, I think this is key information here, so I'm going to share it. Remove the patient from the source of the burn and stop the burning process. Establish and maintain an airway and breathing, ABCs for sure. Classify the severity of the burn and transport immediately if critical, all right? Cover the burn area with the dry, sterile dressing. It says something about a burn sheet and bowl, so what the fuck? Or a sterile, particle-free, disposable burn sheet, or an approved commercial burn dressing. All right. Keep the patient warm and treat other injuries as needed. And lastly, transport the patient to the appropriate facility. And after that, we have special considerations for dressing burns. In dressing a burn, follow these guidelines. 1. Avoid using any material that shreds or leaves particles, since this may further contaminate the burn. 2. Never apply any type of ointments, lotions, or antiseptics to burn injuries. This may cause heat retention, and hospital personnel would most likely have to vigorously cleanse the area of any debris material. 4 or 3, so I can't count for shit. Never break or drain blisters. Never break or drain blisters. That's like common fucking sense. But this may cause further contamination and potential for fluid loss. All right. Special areas of concern when applying burn dressings are the hands, the toes, and the eyes. In those areas, follow these guidelines. For burns of the hands and toes, remove all rings and jewelry, which may constrict with swelling after the burn injury. Separate all digits or fingers with dry, sterile dressing material to prevent adhering of burn areas so the fingers don't stick together. For burns of the eyeballs, do not attempt to open eyelids if they are burned. Do not attempt to open the eyelids if they are burned. Determine if the burn is thermal or chemical. If thermal, apply a dry, sterile dressing to what? Both eyes, all right? Both of them. If thermal, apply a dry, sterile dressing to both eyes to prevent simultaneous movement of both eyes. Chemical burns should be flushed with water while en route to the hospital. Flush the eye from the medial to the lateral side to avoid washing the chemical into the opposite eye. Of course, you know. But anyway, that's common sense shit, but I think it has to be said. Chemical burns should be flushed with water while en route to the hospital. Here's the common sense part. Flush the eye from the medial to the lateral side to avoid washing the chemical into the opposite eye. See more about chemical burns in the following section. All right, let's talk about chemical burns. I left a lot more off than I thought. Yeah. All right, chemical burns look like it's, no. We're going to talk about chemical burns and then electrical burns. What's the rush? You got the time to learn, right? Chemical burns. Chemical burns require immediate care. Since the longer the chemical is in contact with the skin, the greater the potential for injury. In many cases, emergency medical care may be started by people at the scene. Industrial sites may have special response teams or emergency medical responders and equipment available to provide initial emergency medical care. However, You should follow these rules when dealing with chemical burn injuries. All right. Protect yourself first. Yep. Dry chemicals, examples given, dry lime, should be brushed off before flushing with water, because of course after that you're going to cause an absorption injury along with contact. Well, they're both absorption, but you're going to flush it deeper into their pores. Anyway, and lastly, most chemical burns can be flushed with copious amounts of water, all right? Hella water. Electrical burns, let's talk about that. Electrical burns, including those caused by electrical currents and lightning, can cause severe damage not only to soft tissues, but to the body as a whole. Electrical energy will always seek to flow to the ground, right? As the energy enters the body, it will seek the path of least resistance to exit the body. All tissues between the entrance and the exit of the current will potentially be injured due to the extreme heat created by the resistance of body structures to the electricity. Oh, okay. Since the body, especially the heart, produces its own electrical energy from chemical reactions, electrical injuries can disturb or destroy these functions, causing irregular heartbeat or even cardiac arrest. Scene safety is crucial in electrical burn injuries because of the extremely hazardous nature of the electrical source. Always assume the electrical source is still charged up unless you have received reliable information that the power source has been completely shut down. When caring for electrical burn injuries, 1. Never attempt to remove a patient from an electrical source unless trained and equipped to do so. Basically, don't grab anybody with your damn hands. Don't do it. Don't kick them with your foot. Don't rub them with your bow. Don't headbutt the motherfucker off. Never touch a patient still in contact with the electrical source. That's the 2, all right? And that's what I just said. 3, for the 3, administer oxygen by non-rebreather mask at 15 liters per minute or positive pressure ventilation with supplemental oxygen if necessary at a rate of 10 to 12 breaths per minute in an adult and 12 to 20 per minute in an infant child. All right? In an infant child, how many you going to do per minute? How many breaths per minute? 12 to 20. Ventilations per minute, should I say. How many ventilations you going to give an adult, you say? 10 to 12 per minute, all right? It's less, all right? If necessary, all right? Supplemental oxygen, if necessary, at a rate of 10 to 12 per minute in an adult and 12 to 20 per minute in an infant or child, all right? Monitor the patient for cardiac arrest. Be prepared to administer CPR and apply an automated external defibrillator, AED, if the patient deteriorates to cardiac arrest, all right? You're going to assess the patient for muscle tenderness with or without twitching and any seizure activity. Always assess for an entrance and exit burn injury, kind of like a gunshot. You want to look underneath their foot or, at the tips of their fingers or in their hand because, remember, the electricity is trying to find the ground. So, yeah, look at the bottom of their foot first, always. All tissues in between is suspect for injury, even if not readily visible. Emergency medical care for entrance and exit injuries is the same as for other thermal burns, all right? And lastly, now, for real, this is the last one. Transport the patient as soon as possible, all right? Most electrical burn injuries have a slow onset, and underlying tissue or organ damage may not be readily apparent. These patients should be assumed to have critical injuries, even if burns appear insignificant, all right? And that is the end. Boom.